Good morning and good afternoon, and welcome to the last session on Thursday for Africa Week. This session is on the business of healthcare in Africa. And we've heard a lot this week we've been a lot of discussion on research and policy, and we just heard a discussion about global health and a lot of policy related. And this one is specifically on business and the business opportunities. I am Paul Clyde. I am the president of the William Davidson Institute and on the business economics faculty at the Ross School of Business. And the development of businesses, which is the subject of this, is core to the mission of the William Davidson Institute. Because, paraphrasing Bill Davidson, profitable business can be a force for economic and social freedom. And so looking at the opportunities out there is an important thing to be considering in this week. And there are plenty of reasons within the healthcare area to believe that there are opportunities there and that they will grow. Just a few points of information: healthcare expenditures in countries that were in the low and middle income country category in 2000 increased 3 times as fast as they did in the high income countries in the subsequent 15 years. Now, COVID has set that back a little bit, but it is expected to continue. Also, we've heard a lot of discussion this week about the African Continental Free Trade Area, under which trading began last month, but that presents enormous opportunities today with over 1 billion people in it and a combined GDP that exceeds that of France. So these opportunities present clear chances for local companies in Africa, and we're going to hear from 2 of them, but also for multinationals. In fact, arguably, multinationals have a bigger challenge because they have a significant opportunity there. And if they don't capitalize on it, they run the risk of fostering the growth of a new group of competitors who could not only compete with them in Africa, but also in some of their other profitable markets around the world, which would be either way, we're seeing the development of business in Africa, which will benefit the people of Africa. So with that in mind, we have 2 representatives from 2 African companies and 2 representatives from multinational companies. And I am delighted that they've all agreed to join today and really look forward to their insights. So let me introduce them before turning to them for some opening statements. First, we have Brooke Fikadu, who is the founder and CEO of Pioneer Diagnostics Center and Infinity Advanced Technology Solutions. Both companies were established in 2006. Pioneer is a medical diagnostic imaging service provider, and Infinity is a medical equipment import and distribution company with offices in Addis Ababa, Ethiopia, and Nairobi, Kenya. In Ethiopia, Infinity represents companies like GE Healthcare, Boston Scientific, Karl Storz, Zimmer, and in Kenya, Infinity currently provides maintenance services for 98 county hospitals. We also have William Hrobler, who is the commercial director for South Africa and Sub-Saharan Africa at Convatec, a global medical products and technology company focused on therapies for the management of chronic conditions. Willem has worked with the medical industry in South Africa for the past 20 years with other companies such as Stryker and Medtronic prior to joining Convatec. He's also worked in Ghana and Kenya. Next, we have Chemu Langat, who is the regional head for Africa under Medtronic Labs, a social enterprise within Medtronic with the mission of expanding access to healthcare in underserved patients across the world. Chemu previously served as principal biomedical engineer working at Medtronic's cardiac device R&D programs. And prior to that, she was a systems safety and reliability engineer at NASA's Johnson Space Center, ensuring safe design and operation of the crew's medical and exercise equipment. And finally, we have Vinesh Premlal, head of new business development at Labotech, a lab equipment supplier in South Africa. He has several years of practical experience in the delivery of healthcare products and solutions within sub-Saharan African markets, spanning from 2013 to present. His management roles range from operational experience to strategic management functions, having had roles as marketing manager, marketing director, and head of business development. So thanks to all of you for joining us. I want to start by getting a sense of the opportunities from each of your perspective. And Brooke, I'm going to start with you. You've successfully started a number of businesses in Ethiopia, and the first ones being back in 2006. How do you see the opportunities for new healthcare businesses today relative to 15 years ago when you first established Pioneer Diagnostics?
Thank you, Paul. Thank you for the opportunity to participate on this panel. When we established Pioneer Diagnostic Center in 2006, there was almost no MRIs. I think it was the first MRI, in fact, for Ethiopia. Most sub-Saharan African countries did not have any MRIs. This is with the exception of South Africa and the Northern African countries are an exception. But most countries did not have advanced imaging equipment. There were a few CT scans here and there, but not many. So, but with that opportunity, there were a lot of challenges because equipment manufacturers did not really consider these countries a market. And even if you were to install an MRI machine, the support, the services, the consumables were not available. So the opportunity was there. The patient volume was there. Ethiopia, I think 15 years ago, the population was around 80 million, and in the US at that time, and I think in Japan, there was 20 MRIs for every million people. Ethiopia, with a population of 80 million, had none. So the opportunities were there for imaging equipment. And healthcare in general, we did not have a lot of hospitals. So you didn't even have to get, very creative. I mean, you can just about do anything because there was just, it was a severely underserved and underpenetrated market. But like I said, the challenges were in terms of consumables, supplies, project execution, site planning. There were a lot of shortages in terms of expertise and the support required to run a business like that. So 15 years later, there's a lot of improvement. 15 years ago, for most physicians in Addis, MRI was something that they had learned about in books, but they hadn't actually seen the films and the images. Now, there's over 20 MRIs, over close to 60, 70 CT scan machines in a span of 15 years. Ethiopia's economy, GDP has grown from, I think in 2010 was around 32 billion. Now it's over 100 billion. And most African countries, the GDP economies have grown significantly. Population is growing. So the opportunities are still there. It's still an underpenetrated market. It's still physicians, hospitals don't have sufficient equipment, and patients are not getting access to the care that they need. As a result, from Ethiopia, for example, a lot of patients go to places like Thailand, India for all kinds of treatment. One example, fertility-related cases, patients go outside, and the value, I heard a recent estimate was $20 million a year. Patients going from Ethiopia to other countries to get IVF-related fertility treatments, just one sector. So the opportunities are there, but also the challenges are there. Now with globalization, access to telecommunications, patients are aware, more aware now what kind of services are out there, and they're demanding these quality care to be available locally. So there is opportunity there. Physicians are aware now of what kind of equipment is out there in other countries. They would like those equipments to be available. When we started, we started two companies because there was no distributors for MRIs in Ethiopia, but now there are distributors for the equipments that we supply and equipments that are provided by some of the panelists as well. So even though we have installed some equipment, Ethiopia and Africa in general still remains an underserved and under penetrated market with a huge potential, but with some risks as well.
So your business model is an interesting one. I want to dive into that a little bit more later, but just quickly now, in terms of the changes, I gather you've seen not only a change in the opportunities in terms of growth of the economy and population, but also many more competitors than you saw before. Is that right?
That is true. So we were the only MRI facility, the diagnostic imaging facility 15 years ago. In 2006, we set up the first one. Now there are over 20 MRI machines. We started representing GE Healthcare. Now other brands like Siemens, Philips are also represented. But then our population has grown, economy has grown, and demand has grown. In the case of Ethiopia specifically, we have hard currency issues. So it is still, demand is greater than supply for consumables, for capital equipment, as well as for other equipment. Today, and we also have 4 branches now. We started with 1 branch. Now we've branched out to 4 locations. I can have 10 more locations and still have the patient flow. We're still in Addis. Our 4 locations are in Addis. We can go outside of Addis and go to the regions. Again, there are some risks and challenges, when you venture out into these communities. But regardless, the opportunities are there. There are people, patients, that are traveling, making long journeys to Addis to access the care from the diagnostic services that we provide. So there's still a lot of opportunity.
Great, thank you. Yeah, and I want to get to those challenges in a second, but before we do, Vinesh, let me turn to you. You are now working at a company that is headquartered in South Africa. You've been with multinationals before. So could you comment on the opportunities from your perspective at Labotech, but then also any differences you see for a multinational versus a local company?
Well, thank you, Clyde, and good morning to everyone. In order to answer your question, Paul, I would like to share my experiences having worked for, as you said, a local company, as well as that of multinationals as well. I'll approach it in 2 parts. Firstly, Labotech as a local scientific instrumentation company operating within the African markets with a business-to-business model. And secondly, from a multinational perspective, operating in the pharmaceutical industry that incorporates both a business-to-business model as well as a business-to-consumer or patient operating model. Now, firstly, if we start with Labotech, Labotech is a local company that represents a number of companies from Europe, from United States, as well as the East. Labotec has been in operation for more than 60 years, and over that time has earned a reputation for reliability and operational effectiveness. Multinational companies feel confident in partnering with us as they are able to enter the market without investing in setting up local operations. And that's very important because there are lots of risks associated with the setup of a company, and especially in a multitude of companies within Africa. Our entry into Sub-Sahara, though, and specifically East Africa, has been based on the request by one of our biggest suppliers. And what they wanted was a company, firstly, that adhered to the global standards that they used to, as well as their operational effectiveness on the ground. And here, what was important, that we have qualified and accredited engineers, and that gave them a sense of comfort. Secondly, the ability to provide the backup, the warranties and servicing. And all too important, we don't want to actually just put in products, but also to be able to provide the after service that goes with it. They needed a company that could attend to the breakdown of their systems within predetermined and agreed to turnaround times, usually 6 to 8 hours. Whereas if you look in South Africa, the turnaround time is about 2 to 3 hours within urban areas. Now, when you're looking at Africa, you're looking at vast distances between pathology laboratories, and they cannot afford to be down, especially when they are providing diagnosis to doctors and hospitals as well. And finally, and I think a very important one, is that they wanted a company that is financially stable and with a good track record. They ultimately wanted a company that is able to adhere to the terms of the agreement, and that helps with the planning. The challenge in many of the countries, actual payments can extend well over the 30-day payment period. Many local companies have a reputation of paying in 90 to 120 days. This can be attributed to a number of different factors, with cash flow being one of them, financial liquidity another, foreign exchange volatility, and hard currency shortages, as mentioned by Brooke. The issue was highlighted in Nigeria last year when there was a slump in oil prices, an economy that is largely dependent on the income from oil. Now, in the instance of Labotec, international companies preferred partnering with Labotec as it addressed a lot of their risk mitigation strategies. Now, when we look at the pharmaceutical industry, on the other hand, it is a bit different, and it's a lot more complex when it comes to decision making. Multinational companies, incorporate both a business to business as well as a business to consumer model. Expansion into Africa is largely dependent on business potential as well as growth possibilities. Underlying the intention to operate in Africa would largely depend on IP considerations within each of these environments. Each country has a different healthcare framework, and entry will largely depend on which business model is ideal. Now, the first one is a sole agent model. That is where you would have a sole agent who will be responsible for all aspects of the business. That is from product registrations to marketing as well as distribution. In this way, the multinational companies are able to manage their business at an arm's length. And this is the least risky on a regulatory compliance point of view, to operate. The second model is more a distributor or wholesale model. Here, the multinational company would register a legal entity in the country and would be responsible for the product registrations and regulatory compliance. The distribution of the product is managed by appointing wholesalers that gives them either territory coverage or customer access, or a combination of both. The wholesaler would primarily be responsible for creating demand locally, usually via their sales initiatives. The model is the most common model implemented by a large majority of pharmaceutical companies within the Sub-Sahara region. The third model is where the multinational company has incorporated a combination of a contract sales force, or a CSO as it's commonly known, as well as a distribution and wholesaler network. The model is different to the first two, as the multinational is responsible for the demand creation locally, whereas the wholesalers are responsible for the availability of the product in country. In this model, the CSO is under the direct control of the multinational company. Now, and then you have finally, a fully established company. The multinational company has set up a fully fledged organization and is responsible for all aspects of business. Now, the large majority of multinational companies operate out of South Africa, and in certain instances, operating via hubs, usually from either Kenya on the east side or even Ghana on the west. Now, here, the model adopted in each of these countries would largely depend on the healthcare framework and the model that best suits their strategic initiatives. So it's a lot more complex, as you could see, in terms of the scientific instrumentation company, which is more a business-to-business operation. So yeah, I mean, that's my input into two different types of businesses within these environments.
Thank you. I think we'll dive into some more of those topics when we get to Willem. Chemu, let me turn to you now. And first, I'm grateful that we have you despite the snow down in Texas and the storms down there. So we'll hope we keep you the whole time. But your background is particularly interesting because you both worked in the core business at Medtronic and the social enterprise where you now are working. Can you comment first on Medtronic's efforts to start up, because there were some significant efforts to start up in the core businesses in some of these markets, and what worked, what didn't work, and then on the reason for the development of Medtronic Labs where you are now.
Thank you so much, Paul, and it's a pleasure to be here with everybody. I do agree. I think I've had the benefit of seeing what a multinational goes through, somewhat indirectly, but then in a few cases directly, as we looked to explore and support the regional business, expand its operations and its presence in Africa. And this was when I first started with Medtronic, more on the engineering role side. But as soon as I got a chance to figure out what the company was doing in Africa, given that I'm from Kenya, I immediately volunteered my efforts towards that. So participated in a business case competition very early on, and this was back in 2012, 2013, and then started getting tapped into what the company was trying to do. And at that point, majority of Medtronic's presence in the region was in South Africa. Mostly, there's some direct operations and sales there, but then majority across the rest of the continent had been through distributors. And so over the next 5 years, there was strategic changes to look at what could we do for more of a direct presence, what makes sense in the different sub-regions of Africa, and additionally, the additional, complexity of country nuances, language nuances, cultural nuances. So as things progressed, we, in 2015, acquired Covidien, which actually also had a presence in Africa, slightly larger one across some of the sub-Saharan Africa region, as well as North Africa. So that did come in with a benefit to the business. The integration followed that. And what we've been seeing in the last few years is really a restructuring of the business in a way that supports the needs of the local market. And it's been interesting because it's actually separate and unique in how they're setting it up for the needs of the African continent, increasing the number of employees in some of the key priority markets, looking at hybrid approaches, not just the distributor model, some of the direct trade and direct operations in Egypt and Nigeria. So it's been interesting to see how things have progressed and where they started off. And of course, I was playing a tangential role, more on the technical side with the interest in supporting the business. But what also came through over the years and where I'm now directly responsible was the need for a different type of organization. And that was what gave birth to Medtronic Labs, a global health social enterprise. And this was the vision of our former CEO, Omar Ishraq. And he had the vision of globalization and penetrating and supporting therapies in the emerging markets. But more so than that, he also looked at what are the needs in many of the markets that we don't currently serve. And while a lot of our products can be accessed in certain areas, in majority of low and middle income countries, there's still gaps that prevent that from happening, infrastructure gaps, system level gaps. And so Medtronic Labs was developed initially within the organization, and then a few years later, separated out and registered as a public beneficiary corporation, allowing us the flexibility to start working as more of an entrepreneurship with the vision of addressing and coming up with solutions in a co-creative manner with local government, with entrepreneurs in the countries we are operating in, as well as setting up for financial sustainability using different types of innovative business models. So while I think Medtronic's vision and strategy in the region has really grown and has actually started to impact more and more patients, and I know they have much big, bolder vision statements coming out as we look ahead to the next 5 years. Alongside that, this social enterprise is also growing in Asia, but also in East and West Africa at this point, as we look to expand outside of Kenya and Ghana, where we currently have local entities and teams to see where else can we collaborate with others who are doing work in the non-communicable disease space. Where can we bring together end-to-end chronic disease models that leverage digital health, that leverage local diagnostics, but that tap into and build up the health system, especially at the primary health and community level.
Just to add to that, can you, am I right in thinking that the Medtronic Labs is looking at the markets that it's developing and looking for partnerships there and companies that can be developed there? Because as I understand it, it cannot, because of its legal status, work directly with Medtronic on these things, but can work with companies and help them develop local companies. So what are sort of the goals with respect to developing local companies in the areas with respect to Medtronic Labs?
Thanks, Paul, for bringing that up. And maybe just to clarify for everybody, so Medtronic Labs as a social enterprise registered separately, majority of our funding at this point comes from the Medtronic Foundation. And as a result, we have to be legally separate in how we operate. We cannot directly drive business to Medtronic in the legal structure, but also just in the vision and direction of each of the organizations. So you're right, Paul, in saying that, you know, a lot of what we do is through partnerships and partnerships with local government, but also partnerships with local entrepreneurs, businesses, other multinationals, including pharmaceutical companies, all who have part of the value chain for the patients that we are serving. So we look at things end to end, looking at where can we bring value, trying not to reproduce the wheel, but bring together a solution that brings on, you know, local businesses, local partners that could have something to contribute to the model that we're actually rolling out across the countries we're working in. So that may be a diagnostic company, that may be an entrepreneur, that may be local pharma, that may be local or national government.
Great, thank you. Willem, let me turn to you. You've had worked with a number of multinationals. And I know from talking to you that you see opportunities there, but you think sometimes companies misunderstand the opportunities and the investments that are needed to make those a reality. Can you comment on that?
Absolutely. Thank you, Paul, for the opportunity to join the forum today. I think I just need to start to say what an amazing opportunity for all of us on this call to be part of Africa and to be in Africa. So as you can hear from Brooks' testimonial and Vinesh, what a dynamic environment to work in. It's definitely never a dull day at the office and never boring. So what a great opportunity. I wanted to take my hat off to Brooke. I think just as a comment to him, well done in taking ownership and to develop within a country something that was not in existence and to identify it. And I think this is the challenge that faces all multinationals. So I think some of the experiences I want to share today is personally my own personal experiences and my own views, not necessarily that of Convatec. So yeah, take it from that point of view. So a little bit of a brief history of how Convatec started in South Africa. Convatec went into the South African market about 20 years ago, also through distributors. And the business has changed hands 3 times from one distributor to the next until January 2019, when Convatec decided to invest directly in South Africa and open up a multinational entity in South Africa. And I think if you look at emerging markets in totality and the risks that's associated, or the perceived risk that's associated with emerging markets in operating those markets, you can see the cautiousness of all these multinational companies as they approach the markets. And South Africa being the starting foot hub for sub-Saharan Africa, and most companies will start in South Africa and then breach out to the rest of Africa. And the fact if you look at just purely our own company as Convatec, the fact that it took 20 years to open up a direct entity in South Africa shows you the adversity to try and, or the ability for them to try and mitigate as much risk as possible. We are here now, we're in South Africa. We've been operating from January 2019. And now it's for us to look at the opportunities in the rest of Africa. Convatec started a global emerging markets division, 128 countries in that. And it just shows you the focus that all the multinationals at this stage have to try and access Africa and the rest of the emerging markets and the potential for growth they see. So back to your question on the opportunities, I think there's immense opportunities in Africa, and there's nice steady growth and opportunities. And a lot of that growth is driven by individuals like Brooke, where they actually start development in markets and that development grows. I'm fortunate enough to be close to a Ford factory in South Africa. So Ford has recently invested $4 billion into a new factory in South Africa, or expansion of a factory. And you can automatically see around that factory, all the sub-businesses or the smaller businesses starting to grow around this big factory, and how the whole economy around the factory is being elevated. And again, back to your story, Brooke, like I said, it's really inspirational to me. You can see how your investment has created new opportunities and new competitors. And that's the journey I think we're on with Africa. So yes, it's diverse. Yes, it's difficult to access. Most approaches is business to business, like Vinesh mentioned. I think we shouldn't underestimate the difficulty to enter these markets, and getting to a business to consumer market is sometimes more difficult than purely a business to business. The opportunities that we shouldn't underestimate is you can't drop ship. You can't just supply product. I think supplying product, the days of supplying product has come and gone. It's now about partnerships and valuable partnerships, looking at long-term sustainability in the region. And that is easier said than done. I can give some personal experience when I was still with Medtronic, with an office in Ghana. That office really made a difference for our footprint in the region. You had local Ghanaians in the office, supported by Medtronic staff, and you can actually then try and imprint the Medtronic footprint at that stage, or a multinational footprint within the country, but using local feedback and using local ownership and using local expertise. So yes, there's a lot of opportunity, and there's a lot of investment required. And I think on the investment part, it's time and it's effort and it's energy. A lot of energy and a lot of time and effort that needs to be spent, and education. So not only education to the business partners that you find in the region, but also directly all the way through in the healthcare sector to your key opinion leaders and your nursing staff and your clinical staff. Those are the people that need development, and the more you develop them, the more they will have access to your product and the better care they will provide. And this is the growth that I think Africa is on. So from an economic point of view, yes, the growth might be slow from a physical point of view, but I think the projections are really good. And the more each company, as like on this forum, the more each company invests in Africa, that adds to a synergy of companies, and a synergy of effort to grow the region. So yeah, I think that's just a bit of feedback from my side. I don't know if that answers your question, Paul.
Yeah, and I think that one of the things I'm struck by is whether it's a multinational or a local company, the local training, local skills, and local employment is an essential piece of it. Yeah. And we heard it from both sides of how important that is. Willem, could I also turn to you for we've discussed the difference between successfully starting a business in a market and developing a model that can be sustained in the longer run. Can you comment on the difference between those two and what's needed for the longer run sustaining that's different from the starting?
No, absolutely. So entering a market, I think, is fairly easy with all the distributors that we've got in Africa, and there's a lot of distributors. So I think 10 years ago, you struggled to find a distributor and a partner. That's been growing successfully in the region. And now you can really pick and choose to find distributors that can actually support your product. So entry into the market is easy. It's getting that effectively to be grown. And yeah, I thought of this question, and I think the topic that we have to discuss is maybe a lack of institutional memory. So when you look at these new enterprises opening up in Africa, trying to supply product to hospitals and clinics around, they do not have the 20-year, 30-year experience that some of these multinational companies might have. And that's a culture that's built into these companies. So as Shemu mentioned, I joined Covidien before they became Medtronic. Yeah, and if you look at that journey of going from the one to the other, you learn a lot. You bring a lot as a new representative. When you join a new multinational, you go through 2-3 months worth of training. You get taught how to sell, how to grow customer relationships, how to enter a market, and how to position and propose your product. The distributor necessarily distributing 20 or 30 different products in the market as a new distributor, they don't have that legacy of information and coaching and history to back them up. And that's the important part of the multinational supporting a distributor. So the only way you'll get the success in these markets is really to invest time by educating both the distributor and the market. And it's a long-term partnership. And when we say partnership, it's not selling product. I think that I've mentioned that previously as well. It's not about selling product. It's selling the right product for that economic environment. And Africa is not a cookie cutter. You can't make the mistake, or you shouldn't make the mistake, to try and enter Africa through Southern Africa and decide you're going to implement exactly those products in the rest of Africa. Most of our African sales that we've got in the company at the moment is product for products we do not supply in South Africa. So you have to tailor make and customize your offering to each country individually to their needs. So it's getting the right product there, not overstocking those markets. And then we look at a true partnership. It's being with that distributor or that agent that you use in the region through the tough times and the good times. The good times always start with that first order. The tough times start when you have to get all that product utilized and before it expires. So it's walking a journey for a long term with a company. So I think that's the difference between entering and developing. It needs to be a true partnership. And again, I speak for myself. I think that's the challenge for multinationals, is they want to play, but they struggle to get their hands dirty. They struggle to have the compliance and the agility to be flexible enough to accommodate rules and regulations in all these countries. That's completely different from anything outside of Europe and the US. So this is the challenge. And I think, like we said, Paul, the companies that's willing to get their hands dirty, that's willing to go down to a local level, understand, learn, adopt, and to change their policies and procedures to actually effectively work in a certain country, they will be successful. But if you are constrained by the historical way of doing things and by all the rules and regulations that we've got in our European and our US facilities, you're going to struggle to operate within Africa. We always say, when you're doing a sale, are we going to be on the newspapers the next day? What is that product being used for? So if you are supplying product, you have no idea what's happening to it at the back end. You are putting the company at risk. And these are the questions I think multinationals are asking themselves. What control do they have? And unfortunately, Africa comes with very little control. And this is the mindset you have to wrap your head around. That if you can deal in these dynamic circumstances where everything changes every second day, then you will survive and you will thrive in this market. Okay. Thank you, Paul.
Brooke, do you want to add something to that?
Yes, I just want to say what Willem was saying was like music to my ears, because I'm a distributor, right, on one of my businesses. And especially he was right on training. There's a lot of opportunity in Africa. There's a lot of opportunity in Ethiopia, but multinationals have to invest in the training of professionals. They have to kind of create the demand, train, clinical trainings. It's not like the usual, the regular marketing activities and just highlighting features and functionalities. It has to be capacity building. And if you do that, like I said, when I was commenting, there's more demand than there is supply. The disease cases are there, but the professionals also need some support in taking on these projects. The clinicians need some training and making sure that they can utilize these equipments. If you just sell a piece of equipment and walk away, and it's not used and is sitting in a warehouse somewhere, it's not good for the brand of the company, the multinational that provided the product. It's not good for the patients, and it's not good for the clinicians. So I just wanted to stress that what he just for business, for success, for social responsibility, from many angles, it's just a critical and a very important thing to do in the African context. I just wanted to highlight that.
Brooke, actually, could I've told you before that I use you as an example often because I think your business model is fascinating. And maybe you could expand on that, because people don't know the role you play in this. And you were the one that taught me a number of years ago that it's not about the equipment. It's not the expense of the equipment. It's, do you have the trained personnel to install, maintain, and repair the equipment? Because especially if you're talking about something like an MRI, you don't want that down at all. And so that's what makes it that's what determines whether it's a make or break. So could you talk about how you developed that within your company, and how you're trying to expand on that?
Yeah, so 15 years ago, when we started, there was no MRI. Was it because no one can afford to buy an MRI machine? The answer is no. There were plenty of buildings and other capital equipment that were more expensive than an MRI. It was more the complexity associated with installing and operating an MRI machine. And we came with that expertise, and then that's why we set up two entities. One entity that was working with supplying consumables. We had to train our own engineers, and the customer was the diagnostic business. And later on, the reason our business here for digital imaging, diagnostic imaging with GE Healthcare, the reason we're successful is more due to the fact that we had this diagnostic imaging center that was not only providing clinical service to patients, but when we sell equipment, it was being used as a training facility. So GE, as a multinational, has a 3-day training that is included in the package when we sell a piece of equipment. And this training basically assumes you're already versed in how to operate an MRI machine, but maybe you were working on a Siemens machine. So they just kind of acclimate you to how the GE software works, application works. We found that that was not enough. On many occasions, the technologists and the radiologists and the professionals working on these machines had only learned about these machines in books. They didn't understand the workflow. So what we started doing was 2-3 months before a customer was due to receive an equipment, we pushed them to hire or to send their professionals to sit in our facility and learn the software, learn the workflow, learn the process. Then by the time the equipment comes and the GE trainer is there, they're actually asking questions. They're actually, engaged and not feeling like they don't know anything, but really engaging, and the projects ended up being successful. This is really the main reason why GE in Ethiopia has a significant market share. Add to that, so the training is one aspect. The second aspect is, there are consumables. So I will use the example of, let's say, an MRI equipment. When you buy an MRI, you have to print the images on film. At least that's how it was on, 15 years ago. These printers that come, with the machines, they're specific. So you cannot buy any film, and the printers will not print, on any film. So that you have to buy a specific printer and a specific film, specific brand of film for that printer. And if that brand of printer did not have a distributor in country, then you are stuck. And if you scan a patient, but you cannot give the results, print film and give the patients their results, that was as good as not scanning them. So we had to make sure when we supply a machine, we had the film that the results were going to be printed on, contrast media that the patients need for that is needed for scanning, the injectors that are required, all the consumables. So, and our business model turned into, we say we're not selling products. And that's why I like the Willem's comment, because we say we're not selling products, we're selling solutions. Shamu would know this. When you sell a cath lab machine from GE, there are a series of consumables. You have to have the injectors, you have to have the stents, the pacemakers, the guide wires. There's a series of things that are required to operate a cath lab machine. If you just sell a cath lab machine and walk away, in our environment, a European hospital would know what's required, and they would have pre-planned and arranged everything. But in our environment, it was projects fail because all the required consumables are not available. Training is not available. After sales maintenance may not be available. Equipments fail because the expertise was not there to properly plan and ready a site for a specific machine. So what we did was, because we had set up these two businesses, we could see the challenges on both sides, and this worked out very well for us. And one piece of advice that I would give to any multinational coming and planning to do work in the African continent is one of your main marketing activities has to involve training and capacity building, just generating the demand. When the physicians are skilled on a given equipment, then they will require that, especially in the university hospitals. That the smart thing to do would be to put equipment, even for free, in teaching institutions, so that students graduating then have developed a certain level of comfort on equipments, so they can then buy and order the requirements. There's no lack of patients patients, I know we have a lot of patients, but it's also important that they have the power to pay for these services. Like I said, at least from Ethiopia, many patients are traveling abroad to different countries to receive care. And that care can be provided locally. And physicians are there, but they need, in addition to what they're learning at the medical school, they need the hands-on skills to use these equipments. And that is critical and fundamental to success in our environment.
Great.
Brooke,
Thank you. Go ahead.
sorry, Paul. Brooke, I just wanted to add on to that. And a mentor of mine once said, success in one country does not equal the same success in another country. And I think while we're talking about Africa, every country in Africa is so different. So a lot of, this is the challenges we face as well. And similar, like I said with GE, if they take their approach in South Africa or their approach in Europe or the US, and they just employed and said, this model has been tested for 20 years that works successfully in my region, I'm just going to duplicate it into another region. You can clearly from your example see it won't work. You have to adapt to each region. And this is what makes Africa so much fun. Every single country is so different. Thanks, Paul.
Yep.
Can I just jump in there as well? And I would just go back to what Willem said earlier as well. I mean, all too often we find multinationals, they manage, the continent from South Africa. A lot of them haven't even been on the ground. They haven't traveled. They haven't experienced the challenges that the healthcare professionals or the patients or the pharmacists are actually experiencing. And how are they able to develop these strategies if they don't understand the challenges on the ground? They have to commit. And all too often, we find many of the multinationals, they say they're operating in Africa, but all they're doing is actually, getting product into the ground, into the wholesalers. They're not creating the pull-through down to the patient level. And that cannot be viewed as success. We have to commit as companies. And I'll give you another example. In Kenya, we had a scenario, especially in the diabetes arena, where management at the government level, the turnaround on the nurses was 3 to 4 months. And that is why they were having huge challenges in terms of managing the patients effectively. So what we did was we put a PPP in place. We approached government, we approached the Nursing Association, as well as the Diabetes Association. And we put a program, an education program for the nurses over a 2-year period. Now, we were prepared to invest that money to ensure that the patient at the end of the day, and especially in the public sector, gets proper treatment. Now, the issue and the challenge, and a lot of the times, the government does not see it as well. If you have a quick turnaround of staff, which means that the nursing staff from the diabetes sector is going into the cardiovascular sector, you're not going to have a proper management of the patients. And if we were going to invest that money, we had to make sure that the government had to actually implement a policy that ensured that the nurses stayed in the hospital sector or in that department for a minimum of 2 years. And once they agreed to that, we were then able to invest and put that money, when we got down and we put an entire program together in terms of education to the nurses itself. And that actually went down very, very well. And I think, as from a multinational point of view, we have to look at these things practically, number one, and do it a lot more often if we really want to be successful.
Gemma, do you have anything you want to add to that?
I do. I'm actually glad. Thank you for bringing that up, Vinesh, because I really think fundamentally when we think about healthcare in Africa, and most of us being in the private sector and realizing that a large majority of the patients are not cannot access private healthcare for various reasons. And it's also not set up for scale. we have to start to consider more innovative models and also start looking at these strategic partnerships. The PPPP, the private public patient partnerships, are really fundamental to us as we look ahead. And I'm speaking on behalf of Medtronic for this, but also Medtronic Labs, as we think about financial sustainability as businesses. Part of what comes with capacity building and setting up the health system strengthening is the need to make sure that you're actually integrating into the health systems and integrating into the health systems in a way that ends up allowing for that sustainable access, but also sustainable financing. And the business models have to be very different than what we're traditionally used to. So this is where I think the PPP and PPPP approaches are critical. Being able to bring the governments on board to understand some of the health inequities, being able to give them access to data that they do not have today. I think this is one of the biggest pain points, is we understand we have a challenge, but we don't know how big it is. We don't know how to make decisions. And of the data we have, this is what we're sort of allocating, but in reality, more needs to be allocated, and we have to be able to support them in understanding the challenges from a numerical and economic perspective. So I think of it more in terms of hand-in-hand partnership as we move along, private sector playing their part, but at the same time collaborating healthily with the public sector and also with the civil societies and the unions to make sure that we have something that is practical, as you said, Vinesh, but also something that lasts beyond what we are doing as an individual company. We're building up the health system so that this is replicable. We are addressing some of the fundamental system challenges as a whole, not as one company or the other. So this is what we've been doing in Kenya and Ghana with PPPs, really working with multiple partners across the different sectors, but also trying to build it into the financing mechanisms that can be supported long-term as you think about healthcare for Africa, achieving our SDG goals. How do you ensure that the health system can finance it and it doesn't just come back directly to the patient who may not be able to finance? So we've been looking at that, building that into the national health insurance models, looking at tariff-based approaches. And I'm trying to answer a question that came on the chat too, but looking at different mechanisms, outcomes-based financing, where there is going to be return and you can actually justify the value of what's being given. So a couple of different things at play here, but really echo what Vinesh had kicked off with the need for PPPs and those type of strategic alignment.
Let me stick with you on this one because you and I talked about it before, and it is a question that came from the audience. Maybe one of them you're referring to. But the question is, the reliance on the private sector in healthcare in Africa raises questions about the exacerbation of health inequities as those with means get greater access to the scarce health resources available in African countries. How can this be overcome? What are the financial models that can be used to ensure access to the poor to these private sector healthcare goods and services? Can you comment on that?
Yeah, and I was trying to
conversation we were just having.
Yes, and I was trying to touch on that a little bit, but maybe to dig deep, I think a lot of the health system strengthening aspects are really driven by the challenges across the various countries, and some of them have the same flavor, some of them are different, but they're system issues, and so we are not trying to propagate these inequities. And I think that is why, as a whole, we're trying to figure out the best way to do business effectively and build up. You hear a lot around capacity building. Primary health system needs a lot of investment, and we need to be able to figure out how to bring the health back to the community level. For every dollar we invest at the community level in an integrated health system, there's a return of $10. And that's heavily reliant on some of the community health worker models, community intervention models that have the bones exist, the structure exists, perhaps strengthening of some policies is needed, and then strengthening of the strategic partnerships in a way that can help finance healthcare and finance the businesses as a whole. So I would say there's a few different models to explore. We've been exploring direct service with government entities. we've been exploring co-funding and co-financing of solutions with other private sector partners. But we just started recently looking at results-based, that's what I was referring to, results-based or impact-based financing as well, so that there truly is, it's return based on value that has been provided. But these areas of inequities have been fundamental to us, really. Even the fundamental basis of why Medtronic Labs was set up is to try and address that.
Willem, did you have a comment on that?
I think just listening to all the great comments made, I think the key thing here is a vision. One should have a vision for Africa and a vision for what you're trying to accomplish, and then that backed up by great leadership. And I think that's all the way from a multinational to a local company doing its local endeavors. And I think it's about that attitude of wanting to grow and wanting to improve. So if you look at all the comments made and all the investments made from all companies, it's clearly people that's got vision, that see something better for the African continent than probably what they are dealing with at the moment. There's a lot of external investment entering Africa. If you look at China's investment, I can talk for the SADC countries around us. I can just see bridges being built and railways being put in and harbors being built. So there's a lot of foreign investment coming into Africa, both serving probably, I think sometimes it's for their own needs and sometimes it's for real partnerships. Be that as it may, it's still infrastructure improvements that's coming in. But there is clearly that vision required and that leadership required. And I can really comment from a Convatec point of view, if I look at our CEO, Karim Battar, and Supratim Bose, the heads up our global emerging markets division, they've got that clear strategy to say, you know what, we as a company, we are here to improve the lives of the people we touch. And that is a totally different mindset of selling product and trying to achieve our financial goals. So this is that soft approach, I think, that will make Africa win, is really to look past the quick wins and to have that vision and that strategy for long-term success. Thank you.
Yeah, and I also think, this session is on the business of healthcare in Africa, but that doesn't mean there isn't a role for other entities. And certainly the government has a role in working closely with the government, and public-private partnerships is one way to do that. And you can also separate the payment of services from the provision of the services. So the government can come in and pay for some of these for their own citizens, but it could be the private sector that is supplying those services. So there could be a relationship there. Another question came in: the COVID-19 pandemic has underscored the challenges associated with dependence and importing medical equipment and supplies on the African continent. To what extent are companies exploring local production? What considerations are needed to make local production possible? And I would just add to that, the new free trade area that I know isn't necessarily top of mind for companies right now, but that seems like that would present an increased opportunity. If something is produced in Ethiopia and can be transferred at a low cost all around sub-Saharan Africa, that seems like it would be enormous potential benefit. So who wants to address this?
I can maybe just comment first, just as a short comment. I think the approach of many companies is to adapt their current production to cater for this market, not necessarily looking at local production. So again, it's getting that market entry and that risk associated with the local production. And I think to Brooke's point, to manufacture in some of these countries is difficult. Your core product might be easy, but the supporting products and access and supplies remains a challenge. So it's a long road to go to really get that going, I would say, in Africa, where I think a lot of companies are taking the approach to adapt their products wherever they are manufacturing at, being at Ireland, China, US, wherever, is to adapt the product to suit the market more so versus just the local production. There's also this risk, I think, from a company point of view, that we are supplying products into Africa at lower costs to try and accommodate for the economic situation in the continent. And you have a lot of parallel importing from Africa back into Europe due to the price differences. So there's a lot of complexity when it comes into producing low-cost product in Africa. Yeah, thank you.
Brooke, you have anything to add?
Yeah, just I think I agree with Willem. It may make sense. Local production may make sense. This is maybe Vinesh can also comment on this. For example, reagents for laboratory equipment. So you're, you know, the production requirements, the staffing, the technical requirements may not be that high for reagents. Those are the types of things I think would make sense to produce locally. You can just bring in the, I mean, I don't understand that area, but you know, you're paying a lot of money for freight for where you can just bring in ingredients and actually develop the reagents. So there are some areas where that may work, but in terms of manufacturing equipments, will be a challenge. Assembling might be okay, where pieces come and you put them together locally if you're, you know, saving cost on shipment or what have you. But manufacturing, you know, because of volume, you know, not just because the economics, because of volume, a Chinese manufacturer may produce that item for a fraction of the cost and may not even be competitive. So there are many challenges in addition to power, IT, trained resources to work in the factories. There's a lot of challenges, but there are some products maybe that are simple to produce that may be candidates.
Let me push on that a little bit, just because, I mean, we heard earlier this week, and it's known that the working age population in Africa is going to grow significantly and be significantly, while other continents are decreasing. So the population and the market and the size is growing. And if we look at sort of the evolution I know of companies in India that tried to go in there years ago and bring their product and adapt it to that. And they ultimately whittled it down to a core element and then sourced other pieces, components of that product locally that gradually moved toward them manufacturing. So it seems to me it's likely at some point, it's a question of timing of when that might happen. Vinesh or Jamud, either of you have comments on that?
Well, that's interesting, Paul. I mean, in the last 2 weeks, I mean, I had a discussion with a company in India that, you know, we're looking at bringing down the line onto the continent. And this is a defibrillator that is a hand-cranked defibrillator. Now, if you look at the challenges that you have around power, and we're having it more and more in South Africa, but in Africa in general, you do have these issues. You know, it is these kind of solutions that we want to introduce into the market because it's real and it satisfies a definite need. And more often we find, even beyond, you know, the equipment and what Brooke was saying, there are companies that, you know, are manufacturing locally and we need to support them. I think one such company is Cape Bio, that are able to or are manufacturing reagents locally. And we are supporting them as far as possible as a local manufacturer. And, you know, once they are ready, we are able then to take that into the rest of Africa. If we're looking at, and there was also a mention of the COVID products, I mean, Aspen Pharmacare has, you know, or will be actually manufacturing the J&J vaccine as well out in East London. And hopefully, I mean, this is destined for international markets, but hopefully, I mean, a large proportion of that ends up in Africa itself. Now, in order to keep the prices, you know, at a fair price, we have to get the volume and get the economies of scale. So there has to be an investment in these operations for us to be effective and to be able to be self-sufficient on the continent.
Jamud?
Yeah, I agree. And a shout out to Ashish from Givtronics, who shared a little bit of the hand crank defibrillator, because I think when you look at the unique needs of the African market and the the capability to actually manufacture some of the product, I agree. I think the volume does drive a lot, but there's also the need to actually make sure that we are leveraging what exists and is just needing the support in scale up. So this is an interesting area where innovative technology in the healthcare space, different types of solutions are actually on the rise amongst many of the entrepreneurs in the countries that we're operating in, but their capability to scale what they're locally producing is very low. And this is where I think there's opportunities for partnerships where you see the value of what they can produce, maybe just some connection to a manufacturing plant, support in certain aspects of their value chain. So I think there is definitely a need for local production of more and more of the medical and healthcare technologies, especially in this phase as we move beyond, with the challenges of the COVID pandemic. But there is definitely an influx of support in infrastructure and manufacturing capabilities that will need to come along with that. But that is where I think looking at who else can support that. And it was really interesting in the beginning of the COVID pandemic, where all of a sudden, with the influx of innovative solutions, we started seeing different local companies actually step in and start to produce needed components or needed systems. So it's been actually, I think there's a journey we're on here where we're also learning to repurpose what has already gone ahead of the health industry and other industries such as automotive to help us do more local production. I think we just need to keep focusing on that and not only focus on it in emergency times, but actually look at cross-pollination of the local manufacturing capabilities. And I talk to this more from a defibrillator and then also from a ventilator perspective when we started looking at local production of open source ventilators.
Great, thank you. So we have about 6 minutes left, and I want to ask one last question of all of you. And it's related to what we were just talking about, because there's been a lot of talk about the importance of training and the skills that are available both for distribution, but also in the manufacturing. And, I have always had high hopes for what might the future of this, because, if we think of what Chema was just describing, products that are specifically designed for Africa may be designed for Africa today, but we may discover that they are much better suited to serve more markets than just in Africa. And so the opportunities there could be significant. And, getting back to the population, the demographic changes in Africa and the working age population, that's both a challenge and an opportunity. I mean, there are a lot of jobs that are going to be needed in the coming years, but that also means there's a significant population out there to support manufacturing and service industries like this. So if you were, starting your career, within healthcare, what either business would you start, sort of industry, or what skills would you be focused on, just sort of given what you see about the future opportunities in Africa? Vinesh, let me start with you.
I think in terms of, I've been giving this some thought and I've been in discussions with a company, and usually a tech company. I think one of the biggest challenges that are facing the continent is basically, counterfeit drugs. We have parallel importation. There's huge challenges in terms of the supply chain and the integrity of that. And the one area that we're investigating is using blockchain to actually support the supply chain. And how are we able to validate product, from the manufacturer all the way to the patient? Because that is a huge challenge. We find in Africa as well that there are as many illegal pharmacies as there are legal pharmacies. And this provides a huge problem for illicit products to end up in the formal supply chain. Now, and there's a huge need, for example, for blockchain to be able to validate these products. So not only can these products be validated by the patient, but also track the product from the point of manufacture all the way to the patient itself, be able to check whether the product is being transported or stored even in the correct temperatures, so that when they are getting these products, it is of the highest quality. It's not a second grade product. It is not a product that is compromised with other ingredients. And we all too often, we also find that, especially with counterfeit. But we need to be able to support the patients at the end of the day, because it is about patient safety. And those are the areas that I'm actually currently looking at. And I think blockchain will give a very, very good solution to that. So time will tell whether that's going to be successful or not.
Great, thanks. Willem?
Yeah, I think if I had to start fresh in Africa, what would I do? Finance, medical finance. I think all the companies I've worked for, we provide amazing products. But for patients to afford the technology has always been a thing that I've always think we've been hampered by. So I don't want to sound like a credit company, but I think if you were able to provide credit for medical aid, financing products in Africa for patients to have access, I think that would be the key thing. And if you could find a model whereby these patients can actually have access to it with limited risk to themselves and paying back that credit, I think that would be how I would approach it. And if I had to do everything over again, I think that's the market I would go in, because it's all about creating more access to healthcare. And I think a lot of companies and a lot of services keep on focusing on the deliverable product, but not necessarily the affordability of the product. So to really assist the patient, even if it's over a 10-year period, so they can go for that operation, their lives can be changed, they can be economically viable going forth in the future, and while affording it and finding that finance mechanism to provide that healthcare. That's something I would really want to investigate, and that's something I would, yeah, if I was starting out fresh with everything I know from the last 20 years, I think that's the key thing for us to access in Africa, is to getting the financing right and the affordability.
Thank you. Jemu?
It's interesting because I also would probably do something very different. I would probably look at how to scale capacity building at all levels of the healthcare system. Really, it's such a fragmented service offering today, and nothing ties together. And you know, in some countries, they've actually been able to figure out how to do this well. But I've seen across the board, when you look at different portions of the health system, all the way down to the primary and back up to the tertiary, and then looking at the different disease states and the technologies and the requirements and who gets what training, and are they able to cater to the patient needs? Do they understand how to operate equipment? Do they understand guidelines? To me, it feels like a big puzzle that we haven't solved yet. Yet we have a lot of technology that can actually help us figure out how to do this more efficiently and even in a remote way. So the virtual capacity building, in-person capacity building, service delivery would be where I would focus.
Great, thank you. Brooke?
I think I'm more aligned with Shamu. Telehealth, in addition, along with the capacity building, would be where I would start. The number of specialists we have, the number of professionals we have, compared to how, the number of hospitals and infrastructure is limited. I think technology can help overcome that. Telecommunications, IT, combined with devising protocols that are needed to provide high quality care for remote villages throughout Africa is possible using telemedicine and telehealth infrastructure. So I think that in fact, that is a huge area for Africa.
Well, thank you, everyone. And I think that gives us a good idea of how diverse the opportunities are that are there, and where all the different needs are and the different kinds of vocations one could be looking to go into. Jamu, Willem, Brooke, Vinesh, thank you very much. I really appreciate it. It was a great conversation. And to our audience, thanks for joining us. This closes out the session for Thursday, and we'll see you tomorrow morning at 8. Thanks
Thank you,
all.
everyone. Thank you for the opportunity. Thank you.
Thank you. Good night.
Bye.